The KUAM News Zoom Room, where we have standing by Margaret Bautista Gay, who's the Public Health Community Health Nursing Administrator. She leads the community testing, right, Margaret?
Yes, I do.
Good morning. Good morning.
Morning.
Did
Morning, everyone.
we have some virtual malasadas in there? There's also some virtual coffee. We have decaf and Starbucks. My mom sent it from the States, so if you want to go ahead and grab one of those. And let's just jump right into it. If you could, Margaret, tell us a little bit about what you do with the Department of Public Health and Social Services for our Network of Nurses segment that we do in conjunction with the Guam Nurses Association.
Well, I'm the Bureau Administrator for the Bureau of Family Health and Nursing Services. I oversee was the Central Medical Clinic at Mingilao, but now we are relocated to Daddy Doe, which are the free services for the pregnant moms, children, and also we oversee the TB clinic, STD clinic, the free clinic. And then I oversee the nurses that go out in the community, which we, as you've seen lately, we've been all over from airport to port to community testing, immunization. So we're the district nurses that go out and see these at-risk communities throughout the island. And I oversee three major grants that relate to the maternal and child health program on Guam. Another one is our systems developmental incentive grant, and our maternal infant early childhood home visiting program, Project Visita y Familia, which our nurses go out to the families and educate them on early prenatal care, child development, and positive parent-child bonding. And also, recently we got two other grants, which are the Family Information Center, which is FERT, and the Preschool Developmental grant. Both of these grants relate to the early childhood families. So they have a place where they can go to assist them in their needs of early childhood services on Guam.
I'm surprised you're not the director with all that experience. My goodness.
No, I'm just nursing.
You're just the HNIC, huh?
Right.
Head nurse in
Yeah.
charge. My
Yeah,
goodness.
nursing. Yeah.
Margaret, let's switch gears a little bit to COVID. So you're leading the community outreach testing effort. So what is it that our people are saying when you're out there in the community and they're wanting to get tested for the virus?
Well, in the beginning, we were there. They didn't come out, right away because the virus wasn't out there. It was there, but it wasn't. The numbers weren't big. But now they want more.
Yeah.
We have controlled it to 200 because our lab capacity does not hold that much. We can't test that much and get the results on time. But we're now looking at targeted. So we go where we're needed to test, and like we test whatever area we're assigned to, and the questions are, when are we going to get our results? How do I stay home? The general questions. But the one I know they're looking for is they want us out more, or they want to know the next one coming up. Now they're really interested. So we're there, but we have to go with what our direction is assigned to us.
And what you do over at Public Health, you guys are getting ready to do this rapid engagement team going house to house,
Yeah.
but you've been there a long time. This isn't anything new that the nurses have done at Public Health. I want to say in the past, you guys have gone out into communities to do outreach, right?
Yes. We used to be, like the flu, we do outreach on the flu, but remember Ebola, our H1N1 before 10 years ago, we were out there. We swabbed at home, and we were able to get the vaccine earlier. So we did the mass vaccination, and we do drills on mass vaccination, on pods of distribution. We do airport drills, we do disaster training and drills with the other partners in the community like Homeland, GPD, GFD, the military. We do more than just give shots, and now we're doing testing. So our job is really whatever comes through public health and needs to be done by nurses or outreach. We're usually the first team to go out.
Right.
Like the dengue, we were there. We were the ones to survey. We're the ones to educate and give the tents, give the repellent. So yeah, so we're the frontliners of the jungle, or the community.
Front lines in the jungle.
The jungle.
Yeah, and you guys.
We yeah, we're out there. Not only the streets but in the community.
How have the nurses prepared for today's house to house? Because you guys really seem to be going into ground zero.
Yeah. I'm not. Yesterday they assessed the area, how many houses, how many people we're going to be testing or interviewing. And so today we will be going, and as soon as I'm done here, I'm going straight down there to meet with the team of nurses and some of our contact tracers and logistics and the other public health people, to go out to these houses, and we're going to assess them and then test them down at the at-risk community area.
I know you have all this experience going out and doing outreach, but this one is really different because of the risk. How overwhelming has it been for you, I guess, this particular response and your team of nurses?
Oh, how many months already? 6 months, almost 7. We are taking a toll, but we're still going because, without the help of the other nurses from DOE and the other newly hired RNs, LPNs, CNAs, we are able to continue our job. But it is taxing, and especially when you go out to the at-risk communities, like we went to the prison, we went out to the homeless shelters, we went out to all these different at-risk areas. And you not only do the job, but you even have that sense of, we feel for them because they lack some of the resources, and during this time where unemployment, and so we're seeing a lot, and we want to do more as public health nurses, which we usually will help them a lot more, but because our response is focused, and so we will get back to them. That's what I say. We're not done. We're going to get back to giving them shots or checking on their prenatal, because there's kids everywhere, families everywhere that need our help. And, as nurses, especially our public health nurses, we don't stop. We just keep going, and we just get on, do our work and continue the mission. But it is hard on us both physically, because I'm not the youngest one there, but emotionally, and that's why I really need, as a administrator and a supervisor, I really need to motivate my nurses to let's continue our job. It's not every day. Every day is a different story. We go different areas, do different things, but it is hard on us because we're nurses, we're also moms, and we have to take care of both ourselves and our families and our patients. So, yeah, go ahead.
The numbers, they're still soaring, and there are people that aren't really necessarily paying attention or following the guidelines. And I guess to give them an idea of just how real and how serious the situation is, can you tell us, I guess, what has been the most heartbreaking thing that you've seen, so people understand, you know, and get the message to stop messing around?
Yeah. Um, we go to the homes when we test, right? And because someone was positive, we go there. Um, we we go to different homes, and it depends on the person and how they're affected with this virus. If it was your auntie that passed away last week because your cousin brought it to your auntie and got her sick and died, it it'll hurt those people faster, and the ones that don't have that connection or don't see the cause of what they're doing can cause lives. They don't see it. And that's what you have to do a lot of times with our job. We have to tell them, if you don't get this vaccine, the baby will die. You have to say it like that, because sometimes they just look at you and say, okay, okay. But you have to make them feel what you want them to feel so they can react to what is happening now. And like Chris says, I really do say stay home, because you need to stay home. You need to stay home to stop the spread and save lives, but they don't get it. And maybe it might be communication. Maybe we need to do maybe a different way of getting it to them. But it really, it's, we just tested DOC. And when they said someone was positive, we're like, oh my God, all our work trying to educate, and then, but at least now they're controlled. But it's hard. It's hard to teach if you can't get it through them, and that's why it helps that we go out, because we're the nurses. We tell you that these are the issues if you don't take care of this issue. If you don't stay home, wear your mask, wash your hands. It does. And we thought it was going to be like the H1N1, like, the vaccine came right away, but it's not. It's a whole different ballgame. Like I was saying, when I educated prior to the COVID, we were educating the nurses about the coronavirus. Little did we know it, we turned around and there it was in front of us. And so, we didn't know about it. And so we're trying to learn about it, trying to educate our clients about it, but we're still learning. We have, as you can see, everywhere, everyone's teaching us something new. And so we feel for the families, because the kids shouldn't get it, and that's what we're seeing. And like you said, the homeless, we tested them and it was the family, and it hurts to see the child get it, because they're innocent. And so again, we have to go back to the parents. We have to educate the parents in whatever way they can. And like I said, I use analogies. I said, this is the virus, goes into your lungs. It's like a big like meconium, if you guys understand. It's like a big a glob in your lungs, and if you don't get that out, you're gonna die. You gotta give them pictures of what can happen. And the deaths are just making me more scared every day for my dad at home, for all my aunties out there, because I don't want that to happen to our family. And I guess we just need to buckle down and get it through their head to stay home, right, and stay in your room and just stay home for 14 days, So, because that's the cure right now, or, that's our treatment for it.
Our best defense.
Yeah. And to see babies get positive, oh my God, that's another one. It's that's not where it's supposed to be at, and we could lose our babies, and that shouldn't happen. So, and I guess being a mom and a nurse, it just hurts to see the people that don't have a lot, are getting it, and it's hurting them and their and everyone else around them.
Margaret, I think what you said this morning, for me, very piercing. There's a lot of people out there, these, anti-maskers, these COVID deniers, just talking so much smack. Mm-hmm. And that's why I think it's important that we get you guys on here. You guys are in the front lines. You're a nurse. You know what's going on.
Yeah.
So thank you so much for coming on here and just kind of letting us walk. I mean, I know it's nowhere close to what you guys are going through, but just for kind of giving us an idea of what it's like to walk in those nurses' shoes.
Yeah.
Thank you so much.
So everyone, it's all the nurses everywhere from GMH to us to school nurses. We're all out there to help each other, help with whatever we can do. And so we just need to help everyone too by educating.
Thank you. So on your way out, grab some of that virtual malasadas for the staff if you're heading up north.
Okay, thank you.
Thank you,
care.
Margaret. Thank you so much, and God bless you and all the nurses.
We should start tomorrow. Today,
Yes.
it's the rain or shine. We're gonna be out there with our blue space, our shields, everything in the sun. So hopefully we'll get this response, into what we're trying to fight for.
Thank you. Thank you so much again.
Good luck today to you and all of your team. Stay safe.
Yeah. Thank you.
Okay.
Thank you, Margaret.
Okay, bye.
Esther, wash your hands.
Oh, wow. She's awesome. You know, I've heard about her, and I've actually wanted to do something with her in the past, and just never been able to connect. But I heard about her and the things that the nurses do, where they go out and they do their outreach into the communities, like Gil Baza, and I'm glad she finally we got the opportunity to put her on the show and highlight what she does and her team.
And thank you to the Guam Nurses Association for partnering with us for the Network of Nurses segment. It's a great segment, and it really provides a lot of insight because, we hear from the doctors a lot, but sometimes it's good to get the voice of the nurses.